Okay, so here we are. We're going to kick off another Ask the Practitioner session. And just wanted to welcome all of you. I think some people might be rolling in slowly throughout the evening. We have about a 25-minute to half-hour Q&A session. This is an opportunity for you to ask any questions that have been on your mind for a while. Trying to keep it in, we're going to put everything in the chat to make it simpler for tonight. And ask away. If I don't know the answer, I'll certainly let you know. But it's a good opportunity to ask some more general questions. If you have like really specific questions about your own personal health, certainly you can put some generalities in there, but we'll probably just need to speak offline to get a little bit more specific to your condition. But I'd like to introduce myself. I'm Dr. Wendy Romig. I am the owner of Sage Integrative Health here in Philadelphia. And Dr. Stephanie Harris may or may not be able to join in. She actually had a patient right before, so I think she's running over a little bit with that appointment. So I'm going to be flying solo tonight with all of you. And so we're going to open it up. The point of the Ask the Practitioner is just a quick, rapid fire Q&A just to get some questions answered out there. But certainly, as I mentioned, if you have any further questions, you can reach out to us directly. You can schedule a 15-minute free phone consultation, and we can take the discussion a little bit more deep. So without further ado, I'm going to open up the chat box here, and we have some questions rolling in. So we have a question coming in that how do we test for heavy metals in the body? And it's so interesting that this question came up because I actually was dealing with this with a patient specifically today. And a patient came in to me. She had shared some older labs. She's experiencing a lot of skin issues, autoimmune conditions, and gut issues. And we've been working for a little bit together and made some progress, but we're still working on the skin stuff. And I had asked her if there had been any toxicity or metals testing done at any point. And she said, actually, as a matter of fact, there has been, but nothing significant. But when she sent me the labs, it looked like there was elevated lead and mercury in her labs that wasn't really addressed by anyone. And it wasn't extremely elevated, but it was definitely in the red zone where it was beyond optimal for her levels. And certainly lead and mercury can create health issues. So what's the best way to test for that? Well, here's the long and short answer. There's three types of ways to test for heavy metals. There's blood tests, there's urine tests, and there's hair samples. So which one do you use? How do you know which one to use? And what I typically will do in my clinic is I will usually start off with a urine test. A urine test will at least show me if there's any current exposure or if there's any exposure that's getting broken down through the body. So things like lead might be stored in the bone. So if someone is having any kind of bone loss, if they're a little bit older, experiencing any osteoporosis, there might be some bone breakdown where lead might be getting released into the bloodstream. So it does clear out through the urine. So it's a good way to test to see if there's any current exposure or if there's any kind of exposure that's been in the body for a long time that's just gradually leaching back into the bloodstream. Of course, blood is the other best way to determine that kind of exposure. So with a blood test, we're going to see more of that current exposure. Hair sampling is going to show some current exposure. It's also going to show exposure over a period of time. It also shows what's being excreted. So with hair, we are going to get a sense for a little bit of a longer term exposure period. What's the kind of gold standard? I usually go with urine or blood over hair samples. I think that the urine or blood is going to give a little bit of a better picture. Here's the thing though. So with a urine sample, especially, there's something called a provoked or an unprovoked test with testing heavy metals. The other thing with urine is that they might want to do a 24-hour sample, which is basically you're taking a sample and you just keep adding to it over a 24-hour period, or you could do a random sampling. So I usually just do a random sampling unprovoked just to see what we're getting. And that's just going to kind of give us a read on what's happening. Provoked means that we are putting some chelating agent and an agent that actually pulls heavy metals out of the tissue. And that chelating agent would actually push the metals back into the body, and then we would get a read on how much is getting pulled out of the body and then excreted. So I typically don't do provoked. I don't do provoked heavy metal sampling. I usually will just do a cold read, because a lot of the sampling is that they're doing, the reference ranges are on unprovoked samples. So we're getting usually an unprovoked read. And it's like I said, it's a snapshot. It's just, we're going to see what's going through your body now, or if you're having any breakdown, either fat breakdown or bone breakdown. And we know that also heavy metals can be stored in fat cells. So if someone's going through heavy weight loss period, this could also be a point where a lot of toxins are getting released into the body, including heavy metals. So if we know someone is on a weight loss protocol, or they are starting to lose weight unexpectedly, and they're experiencing a lot of other symptoms that may indicate that there's some toxicity occurring, then certainly looking at a urine test or a blood test would give us some indication to say, well, you're either getting exposed to it currently, or given the fact that you are going through weight loss right now, we could also say that there might be some stored heavy metals in the body. So I hope that helps answer your question, Tamika, because it's definitely a relevant conversation. And it's something that I deal with clinically, because when we look at heavy metals like lead or mercury, cadmium, thallium, these are all things that don't belong in our bodies, but they end up there. So lead can get in a number of ways. If you have an old house that most houses that were built before the 1970s have lead-based paint in them. It's unless you've completely renovated, put new drywall up, all of that, you're probably, there's paint chipping off, and you might be getting exposed to lead through the paint. There might be old pipes going into the house, which could be over time, they just break down, and that could be putting lead into the system as well, which is a good reason why you'd want to do some sort of water filtration system. If you have had renovations done on an older house, wear a mask 100%. Don't expose yourself to that dust, which is guaranteed to have some sort of lead in it. We know that mercury is going to be coming oftentimes from fillings, the old amalgam fillings, those silver ones. So we want to be really careful about getting those out of the body, but not too fast. I've had some patients that they had a whole bunch of fillings, they had them all taken out within a short period of time, and suddenly they had mercury toxicity. And the mercury levels in the blood were extremely high. So we had to work to get the mercury back out of the system. And so I always recommend, like, do 1 or 2 fillings a year, keep them pretty spaced out, give your body time to detoxify, and make sure you go to a dentist that is really cognizant of safe removal, and just not drilling, popping them out, and there's debris flying all over your mouth. And next thing you know, you're ingesting all of the metals that were in that filling. So these are some things to consider. Mercury can also occur in fish. So, and then we think about cadmium. Cadmium can occur just on our food, in the soil. Thallium is also something that shows up in the food, in our foods chain. So these are things that it's not a bad idea to occasionally get a heavy metals test run, just to see what your exposure looks like. And on the flip side, the heavy metals test actually looks at beneficial metals, for example, zinc and magnesium, manganese, copper, to a small degree. That's, we want to look at iron. So we can get that read from a heavy metals test as well to see, is there a zinc deficiency? Is there copper deficiency or copper excess? How are we doing on our magnesium levels? Are we too low? So there's a lot of reasons to run a heavy metals test that can give a really good snapshot. I do work with a couple of different labs that do that kind of testing. It usually runs about $300 just for pricing, just throw it out there so people know. But heavy metals testing can be, it's always out of pocket. You're not going to get that one covered by insurance. So that's the down low on heavy metals. So there's a question here about the side effects of constant use of NAC. So NAC, N-acetylcysteine, is actually, going back to the heavy metals, it's a chelating agent. So one of the benefits of NAC is that it can chelate. If we're using NAC for long periods of time, we might be increasing chelation, which might be hard on the body. The other thing with NAC is it can change blood pressure. It can lower blood pressure, so it may cause some dizziness. It does work on the liver detoxification pathways. So these are a couple of things with NAC that might occur. When I work with patients, I'm usually suggesting no more than 3 months, and then we might take a break from that and then come back on it again and take a break. So I do like to cycle NAC in. Some people are more sensitive to it than others. And one of the benefits of NAC is that it does help improve our glutathione production in the body. And a lot of people are deficient in glutathione. Glutathione is actually a very, very valuable antioxidant. And glutathione is essential for liver detoxification and phase 2 liver detoxification. So it's helping get clear hormones out of the body. It's helping to clear toxins out of the body. So we need to make sure we have enough glutathione, and that's where N-acetylcysteine can really be beneficial because it's the precursor to glutathione. N-acetylcysteine is that compound that's going to help the body make more glutathione. So if we know we're a little bit short on glutathione, then we might want to keep N-acetylcysteine at a lower dose over a longer period of time. The reason I use N-acetylcysteine is usually because I have a patient that's going through a protocol that might be putting a little bit of extra strain on the liver, meaning that we're doing some sort of gut detoxification, and we're going to, or some sort of chelation process, and N-acetylcysteine is going to help the body get rid of those toxins. So, and I usually do it while the body is undergoing that detoxification process, and then we come off of it. So, and I usually do that at a much higher dose than someone might be on as a maintenance dose if they just have a glutathione deficiency. So that's kind of, and N-acetylcysteine is a great supplement. I use it pretty frequently in my clinic. I rely on it definitely for those detoxification pathways in the liver. So that answers your question. So gut issues and resetting the microbiome, this is a big one. So one of the things that we specialize in here at Sage is complex GI disorders. And so for someone that's experiencing imbalances in the gut, I'll just name a few symptoms because Chris, you don't have to call out your own symptoms, but things like gas and bloating, inconsistency with bowel movements, either loose stool or constipation, a lot of belching, reflux. These are all signs and symptoms that something's off in the belly. And some people just say, oh, that's just how I am. I've always been like this. But it's not considered normal. It's not considered a healthy GI tract. Good GI balance means there's digestion's happening, and sure, there's a little bit of gas and a little bit of bloating that could happen with normal digestion, especially if you're eating a lot of broccoli or cauliflower. But all in all, the gut should be working pretty efficiently. When things start going the wrong direction, i.e. reflux, pushing up, or when you're starting to see things like motility issues where you're suffering from constipation, or which is slow motility, or motility is just things are going too fast. Now suddenly you have loose stool. That's also not a good sign. So resolving GI issues is really first trying to understand what the root cause is of the GI problem. If it is digestive insufficiency, and I'll explain that in a minute. If it's digestive insufficiency, we're going to have to work on one area. If it's some sort of an infection, then we need to work in that area. If the microbiome is just completely out of balance, then we have to work in that area. But we have to know why these things are occurring. So digestive insufficiency is low stomach acid, insufficient enzyme production. That's pretty much in a nutshell. When you have digestive insufficiency, you're probably not producing enough hydrochloric acid, and you might not be producing enough of those important enzymes that are going to be breaking your food down. And that's going to cause maybe excessive fermentation in the GI tract. It can cause undigested food in the stool. It can cause inflammation, food sensitivities, all that fun stuff. Leaky gut, you've heard the leaky gut term before, perhaps. Leaky gut is really just inflammation that creates intestinal permeability. The leaky gut is really when the cells of the gut, they have a protein between them to hold them together. And when that leaky gut happens, that protein opens up. And now you've got food, instead of going through the cells to process into the bloodstream, they're sneaky through the middle. They're not supposed to do that, right? The cells are supposed to process the food. So when we have a leaky gut situation, we now have food particles escaping the GI tract, which is bad. And if food particles are escaping, it's like jailbreak, they get out, they start wreaking havoc in other parts of the body, and the immune system's like, whoa, whoa, whoa. It's like the guards. The immune system's the security guard saying, you don't belong here. You're supposed to be over here. How did you get out here? And now the immune system's going to start attacking and saying, this is bad. You're out of line. You don't belong in this place. We don't recognize you. And this is when you can also start developing food sensitivities. So now you've got this whole cascade of you have low digestion, you have inflammation, you've got food going places it doesn't belong, causing all kinds of problems. And then you have a bigger problem on your hands. So now you've got a fire you have to put out. You're probably not digesting your food very well. And your microbiome gets all out of sorts because the food that it feeds off of might be feeding too much off of certain foods and creating an imbalance. And so how do we fix that? Well, we start with usually increasing digestive power by bringing like a bitters compound into the mix. So I have a herbal medicine background. That's my first line of education, was actually as an herbalist. And then I went to school and got my doctorate in nutrition. But I really lean heavily into traditional herbalism because I've seen it work for a long time. It works so well. For 15 years, I've been doing this, and I see that the herbal medicine is really what's doing the trick with my patients. And it's not herbal medicine in the capsules with a whole bunch of stuff in it. Like, I use traditional forms in tinctures, simple compounds, one herb usually, or a couple of herbs blended together. So getting some herbs in there to stimulate digestion and help break the food down better. Then we need to balance the microbiome out. If there's an overgrowth of, and even good bacteria can overgrow and cause a problem. So we just have to level things out. We want a really diverse microbiome. And if we start getting one family of bacteria overgrowing, it can cause issues. There's also what's called non-commensal bacteria, which is bacteria that's not so friendly. They're the ones that tend to feed off of sugar and starchy foods. And those are the ones that can overgrow and actually increase inflammation in the body. So we have to be really careful about those. But the way that we can address those is we just start knocking them back. We put some herbal antimicrobials in there. And the thing is that when you have an imbalance in the microbiome, you're probably not only having an imbalance in the bacteria, but probably in the fungal population too. So now we're looking at, okay, is there a candida overgrowth? Is there mold? Mold exposure is really common, especially in this region. And so when there's mold exposure, we breathe it in, it gets into our body, it's on our food. And it can actually create a lot of inflammation in the body. So we do antimicrobial, antifungal, N-acetylcysteine helps get all that junk out that you're killing off, right? And then we start looking at a good healthy diet that's going to feed the microbiome. So we want to get sugars out of there, get everything balanced out. So that's, those are some things that are going to help reset the microbiome. It's really, first we have to increase digestive fire, then we have to kill off any overgrowth. We have to repopulate. I like to repopulate mostly through food and not relying heavily on probiotics. Occasionally I'll throw a probiotic in there, but I don't like to rely heavily on them. And this can take months. It's not a quick fix because you don't want to do the same protocol for months on end because the body adapts. If it's a bacterial imbalance, they'll go into a biofilm and they'll just hide for a while until it's safe to come out again. So we have to kind of do a rotation intervention so that the bacteria don't get used to it. And so, yeah, so that's really kind of what we're working with. There was someone had their hand raised, but actually today we're just putting everything in the chat box. So if you wanted to just type something if you want to just type it in the chat box, that'll be a little bit easier today. We'll kind of go through it that way. Yeah, so like I said, I can talk about, the gut for a long time. There's ways that we can test. So as far as testing goes, if we start doing testing, we can look at a hydrogen breath test, which is something, usually a GI doctor can run for you to see if you have something called SIBO. SIBO is an overgrowth within the gut. And if you have SIBO, then we would look at some of those interventions. We can run a stool test, which gives us a snapshot of all the different bacteria in the gut. And then we can make adjustments. We can look at inflammatory markers. So there's definitely a lot of things that we can do to address imbalances in the microbiome. So are there any other questions today? And I can, I had some other topics that I'm happy to speak about to wrap it up for today. Elaine, if you want to just jot something in the chat box, I don't know if you can hear me, but it looks like you're not connected to any sound, so you're welcome to just chat something in the chat box. So the two topics that came up tonight were heavy metals toxicity and some actually N-acetylcysteine, and then also working with the microbiome. When one of the things that with going back to the microbiome, but also toxicity, is mold. And I mentioned that mold can be something that very much can impact our gut health. When you are exposed to mold, it could be through a musty basement, or in your car, not getting the filters changed regularly. There's a lot of different ways that mold can infiltrate, and it can have different effects on different people. I have a number of different patients, and when I started asking them, they had symptoms that were kind of indicative of mold. And when I started actually asking questions like, do you have a musty basement? Do you smell mold anywhere? Oh yeah, actually we have a pretty musty basement. We keep a dehumidifier running all the time. And that's good, but if you're still smelling mustiness, there's mold. There's mold there. And mold can actually really mess up the microbiome. So that's something to really keep an eye out for. And unfortunately, stool samples are not covered by insurance, at least not the ones that we run. So if you went to a GI doctor and you said, I want to get a stool test run, they're going to be like, sure, no problem. And what they're going to run is they're going to run a test for like Shigella. They're going to look for any kind of pathogens, right? They're going to look to see if you have any eggs from any pathogenic bacteria. And so, it's not going to give you much. It'll tell you let you know you don't have a pathogenic infection, which is good to rule out for sure. The stool test that we do here at the clinic is a very comprehensive test. We're looking at inflammatory markers. We're going to look for gluten sensitivity markers. So there's a couple of markers. There's anti-gliadin antibody. There's zonulin, and zonulin is not specific to gluten sensitivity, but it's a marker that indicates whether there's leaky gut, and gluten can potentially trigger a leaky gut if you have a sensitivity to it. So it can be used as a gluten marker. We're looking at calprotectin, which is an inflammatory marker, secretory IgA, which is an immune cell found only mostly in the gut. So, and then, like I said, we're going to get that whole breakdown. So we're going to get those pathogenic bacteria in the stool test that we do. Plus, we're going to get all the microbiome. So I think there's like 30 or 40 bacteria that they're testing right now. And we can get a read on what those levels are to see if there's anything going on. And also we'll test fungal as well. The only thing about the fungal markers, if you're using a stool test to test for Candida, it's not very reliable. I actually don't recommend doing stool testing for Candida at all, because it's Candida is oftentimes in biofilm, so it usually doesn't rear its ugly head too often in a stool test. So it might, but it's not reliable. It's not what I would recommend. I would actually recommend a urine test, because it's the metabolites of Candida that pass through the system that you can test for more directly. And the stool test that we run is about $480. So they're not cheap, but they're really useful. They definitely provide a lot of information. So we're rounding the corner on our half hour set. Well, that flew by. Goodness, yeah. Even with just a couple of questions, it's amazing how time can zip on by. And I love talking about this stuff, so I could talk you guys ear off for another hour. But we'll all go enjoy some dinner. And are there any other last questions in the chat box that anyone has? Okay, great. Well, thank you so much for attending this Ask the Practitioner webinar. Certainly stay tuned. We're going to be doing this a little bit more regularly, so certainly stay tuned to attend more in the future. And of course, if you have any questions, you're welcome to go to sageintegrativehealth.com and sign up for a 15-minute free phone consultation. If you're an existing patient of ours, you're welcome to set up a 15-minute free follow-up session. So look forward to hearing from all of you. Thank you so much for your attendance tonight, and I hope you have a wonderful, wonderful weekend. Take care.